Hi, nice to meet you guys. I'm Alex Senamar. I am the head of U.S. operations at Medopad. This is also really exciting for me because my original company, Sherbet, started out of plug and play and was recently acquired by Medopad. So this is the first time I'm actually presenting the Medopad solution. So Medopad, the vision of Medopad as a company, we wanted to be able to change the landscape of healthcare. Today, most healthcare is positioned around the hospital system. You have to go in to get care, and it's costly. It causes a lot of it's costly, and it causes a lot of it's costly, and it causes a lot of issues with So anyway, what we're doing as Medopad is we're providing a remote patient monitoring solution that helps understand what the patient is doing outside the hospital by tracking a series of data points from different devices they use, as well as understanding what they can do outside the hospital. We can help them engage and get better outcomes. We're proud to be working with a number of large organizations and partners to make this solution possible. We've worked with large governments to roll this out across their populations, as well as leading academic centers to create programs and treat patients with chronic conditions or specific rare diseases, and different insurance companies and pharmaceutical companies to improve the outcomes of their patients. As I mentioned, there's really three core components to the Medopad platform. We provide a series of patient-reported outcomes that a patient can use care team can use to better understand what their patients are doing. This could involve things like a 6-minute walk test to understand the patient's health status. It could be a survey to understand the patient's mood or understanding their medication adherence to specific drugs. We also connect to over 100 different wearable devices that provide real-time clinical information outside the hospital. And we've created over 100 different care plans with different institutions, whether it's post-discharge after surgery or managing a specific chronic condition to help patients improve their care. So the Medopad platform actually brings two components together, and that's obviously the caregiver and the patient. The patient has access to an iOS and Android app that provides them all this information as well as alerts them from when they are out of range and helps intervene before an adverse event happens. The care coordination platform is for the insurer, the company, as well as the hospital to be able to get real-time actionable data on where their patients are at and what they can do to help improve them. From an insurance standpoint, I think it's really time for us to help move and be more engaged in the care. And it hasn't really been that much from the insurance standpoint, and they've started to look more and more into how we can be involved. But these digital data points help us improve the risk models that we have for insurance companies, as well as better understand what our population looks like and how we can engage them more preventively. And also, from engaging your customer standpoint, the more you do that as an insurance company, you obviously will be more likely to keep these as customers and make sure they're actively involved within your programs. And really, the core of all this is three pieces. One is improving the customer loyalty by increasing the touch points of the customer. As an insurance company, it's reducing the cost of that patient by reaching out before those events happen. And in terms of Medopad as a solution, we've been able to normally get up and running with different customers within a 6-week time period. We've had a lot of great press, and we've been able to do really well getting our company growth. We recently raised a round of $28 million, and we have a pretty in-depth partnership with Apple, where Tim Cook actually messaged us on his last earnings call, or the Q3 earnings call. Thank you, and if you're interested in learning more about Medopad, my name is Alex Senamar, and you can reach me at alex.senamar@medopad.com.